Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. We will continue Part 2 of Anatomy and Physiology of the Endocrine System, and we will start this class with the thyroid gland. The thyroid gland is situated in the neck, in front of the larynx and trachea, at the level of the 5th, 6th, and 7th, cervical and first thoracic vertebrae. It is a highly vascular gland that weighs about 25 grams and is surrounded by a fibrous capsule. It resembles a butterfly in shape, consisting of two lobes, one on either side of the thyroid cartilage and upper cartilaginous rings of the trachea. The lobes are joined by a narrow isthmus lying in front of the trachea. The lobes are roughly cone-shaped, about 5 cm long and 3 cm wide. The arterial blood supply to the gland is through the superior and inferior thyroid arteries. The superior thyroid artery is a branch of the external carotid artery, and the inferior thyroid artery is a branch of the subclavian artery. The venous return is by the thyroid veins, which drain into the internal jugular veins. The venous return is by the thyroid veins, which drain into the internal jugular veins. The gland is composed of largely spherical follicles formed from cuboidal epithelium. These secrete and store colloid, a thick, sticky protein material. Between the follicles are other cells found singly or in small groups. Parafollicular cells, also called C cells, produces T4, thyroxine, and T3, triiodothyronine, from iodide and thyroglobulin. T4, T3 conversion peripherally. T3 is the active hormone, increases basal metabolic rate, BMR, heat production, heart rate, and metabolism of carbohydrates, lipids, and proteins. Parafollicular cells, also called C cells, produce calcitonin, whose role is to lower blood calcium by acting on bone cells promoting their storage of calcium. Kidney tubules, inhibiting the reabsorption of calcium. Release of calcitonin is stimulated by increased blood calcium levels. The parathyroid hormones. There are 4 small parathyroid glands, each weighing around 50 grams, 2 embedded in the posterior surface of each lobe of the thyroid gland. They are surrounded by fine connective tissue capsules that contain spherical cells arranged in columns with sinusoids containing blood in between them. These glands secrete parathyroid hormone, PTH, parathormone. Secretion is regulated by blood calcium levels. The main function of PTH is to increase blood calcium levels. This is achieved by increasing the calcium absorption from the small intestine and reabsorption from the renal tubules, and increasing the activation of vitamin D. The adrenal glands. The paired adrenal, suprarenal glands lie superior to the kidneys, enclosed within the renal fascia. They are about 4 cm long and 3 cm thick. The adrenal glands are composed of the outer adrenal cortex and the inner adrenal medulla. The adrenal cortex produces a total of about 40 different hormones, which are collectively known as corticosteroids. The complete loss of adrenocorticoid hormones leads to death within a few days to a week, due to dehydration and electrolyte imbalances. The glands are composed of 2 parts, which have different structures and functions. The outer part is the cortex, and the inner part is the medulla. The adrenal cortex is essential to life, but the medulla is not. Hormones of the adrenal gland. Adrenal cortex hormones include cortisol, corticosterone, cortisone, aldosterone, androgens. Adrenal medulla produce catecholamine, epinephrine, and norepinephrine responsible for fight or flight, increase heart rate, blood pressure, blood glucose. The adrenal cortex produces three groups of steroid hormones from cholesterol. They are collectively called adrenocorticoids, corticosteroids. The groups are zona glomerulosa, mineralocorticoids, aldosterone, sodium retention, potassium excretion, blood pressure regulation. Zona fasciculata, glucocorticoids, cortisol, stress response, gluconeogenesis, protein catabolism, anti-inflammatory effects. Zona reticularis, androgens, weak androgens. Cortisol, hydrocortisone, is the main glucocorticoid, but small amounts of corticosterone and cortisone are also produced. Commonly, these are collectively known as steroids. They are essential for life, regulating metabolism and responses to stress. It is stimulated by ACTH from the anterior pituitary, and by stress, glucocorticosteroids have anti-inflammatory actions. Aldosterone is the main mineralocorticoid. It is involved in maintaining water and electrolyte balance. Through a negative feedback system, it stimulates the reabsorption of sodium, Na+, by the renal tubules and excretion of potassium, K+, in the urine. Sodium reabsorption is also accompanied by retention of water, and therefore, aldosterone is involved in the regulation of blood volume and blood pressure too. Blood potassium levels regulate aldosterone secretion by the adrenal cortex. When blood potassium levels rise, more aldosterone is secreted. Low blood potassium has the opposite effect. Angiotensin, see below, also stimulates the release of aldosterone. Sex hormones. Sex hormones secreted by the adrenal cortex are mainly androgens, male sex hormones, although the amounts produced are insignificant compared with those secreted by the testes and ovaries in late puberty and adulthood. The medulla is surrounded by the adrenal cortex. It develops from nervous tissue in the embryo and is part of the sympathetic nervous system. When stimulated by an extensive sympathetic nerve supply, the glands release the hormones adrenaline, epinephrine 80%, and noradrenaline, norepinephrine 20%. Noradrenaline is the postganglionic neurotransmitter of the sympathetic division of the autonomic nervous system. Adrenaline and some noradrenaline are released into the blood from the adrenal medulla during stimulation of the sympathetic nervous system. The action of these hormones prolongs and augments stimulation of the sympathetic nervous system. The pancreas? Since the pancreas is classified as both an endocrine organ and an exocrine organ, it will also be discussed again with the digestive system. There are three main types of cells in the pancreatic islets: alpha cells, which secrete glucagon; beta cells, which are the most numerous, secrete insulin; delta cells, which secrete somatostatin, GHRIH, insulin. Its main function is to lower raised blood nutrient levels, not only glucose, but also amino acids and fatty acids. These effects are described as anabolic. They promote the storage of nutrients. When nutrients, especially glucose, are in excess of immediate needs, insulin promotes their storage by mechanism by which insulin lowers the blood glucose level, acting on cell membranes and stimulating uptake and use of glucose by muscle and connective tissue cells, increasing conversion of glucose to glycogen, glycogenesis, especially in the liver and skeletal muscles, accelerating the uptake of amino acids by cells and the synthesis of protein. promoting synthesis of fatty acids and storage of fat in adipose tissue, lipogenesis, decreasing glycogenolysis, breakdown of glycogen into glucose, glucagon. Glucagon increases blood glucose levels by stimulating conversion of glycogen to glucose in the liver and skeletal muscles, glycogenolysis. Secretion of glucagon is stimulated by low blood glucose levels and exercise and decreased by somatostatin and insulin. Somatostatin, GHRIH. This hormone, also produced by the hypothalamus, inhibits the secretion of both insulin and glucagon, in addition to inhibiting the secretion of GH from the anterior pituitary. The pineal gland. The pineal gland is a small body attached to the roof of the third ventricle and is connected to it by a short stalk containing nerves, many of which terminate in the hypothalamus. The pineal gland is about 10 millimeters long, reddish-brown in color, and surrounded by a capsule. The gland tends to atrophy after puberty and may become calcified in later life. Function. The physiological role of the pineal gland remains unclear. The pineal gland secretes melatonin, which is thought to promote sleepiness and help regulate the body's biological clock. In animals that breed during specific seasons, melatonin apparently alters their capacity for reproduction, but it has not been shown to have a similar effect on humans. The ovaries and testes. The ovaries and testes are paired oval organs referred to as gonads. The ovaries are the female gonads located in the pelvic cavity. They secrete estrogens and progesterone, which are responsible for the development and maintenance of female sexual characteristics, as well as regulating the female reproductive system, in conjunction with gonadotropic hormones from the pituitary gland. The ovaries also produce relaxin, which softens connective tissues in preparation for childbirth. The testes are the male gonads, located in the scrotum. They secrete testosterone, which is responsible for male sexual characteristics, and inhibin, which controls sperm production by inhibiting follicle-stimulating hormone. The thymus. The thymus gland was previously discussed in the lymphatic system lesson. Hormones produced by the thymus gland are thymosin. These hormones promote the proliferation and maturation of T cells, white blood cells that destroy microbes and foreign substances. Thymic hormones may also help to retard the aging process. The hormones in each group have different characteristic actions, but as they are structurally similar, their actions may overlap.